Hello everyone, I am Dr. Akash. Welcome to my YouTube channel. In Mrcs SEO Shorts, I'll be covering a very important topic today, that is tension pneumothorax. Before proceeding to that, let's understand what is pneumothorax. As the name suggests, from pneumo, it is abnormal collection of air in the pleural space. So this is a picture denoting the pneumothorax. So what basically happens is that there is always a slight negative pressure between the pleura and the atmospheric air. But in case of tension pneumothorax or pneumothorax per se, what happens is that there occurs some entrapment of the air inside the pleural space. In this picture you can see the right side is pathological, as there appears to be some collection of air which is compressing the lungs. Let's move ahead to tension pneumothorax. Before that, I want to mention there is some classification for the pneumothorax, like open pneumothorax, closed pneumothorax, primary and secondary, simple versus tension pneumothorax. I'm not going in detail about the others, but rather focusing on the important topic, that's the tension pneumothorax. So what happens here? There is a abnormal communication between the airway and the pleural space, which acts as a one-way valve. So what is one-way valve? It allows air to enter the pleural space during inspiration, but it cannot go out during expiration. There occurs large amount of air accumulation progressively in the pleural space. The pressure inside the pleura, which ultimately goes above the atmospheric pressure. This is a picture denoting the pneumothorax. You can see it. So what are the effects of the tension pneumothorax? The pressure causes the shift of the mediastinum towards the opposite side. Thus, there occurs compression of the opposite lung as well. There will be impairment of the systemic venous return, causing cardiovascular compromise. Now coming to the clinical features. You have to see for all the clinical features in the question, you have to identify them. There will be a history of like central venous line insertion in an ITU patient, or there will be a polytrauma patient, the trauma to chest. There will be a history of fracture of ribs with flail chest, something like that. And there will be some symptoms like sudden onset unilateral pleuritic chest pain. Along with that, the patient will be breathless. On general examination, you will find cyanosis, rapid 3D pulse, and there will be signs of peripheral circulatory failure. In examination, inspection and palpation, there will be dyspnea. There will be use of accessory muscles of respiration. The trachea will be shifted to opposite side. The mediastinum will be shifted to the opposite side. There will be diminished chest movement. Along with that, there will be fullness of the chest. On percussion, you will find hyper-resonant sound on the affected side. In the picture, can you tell which side looks pathological and which side there is deviation of the mediastinum? In the right side picture, the affected lungs is the left one, as well as in the left side picture the affected lung is the left one. But in case of the left picture, there is deviation of the trachea and the mediastinum towards the opposite side, which denotes that the right side picture is of simple pneumothorax and the left side picture is of tension pneumothorax. Coming to investigation, we have to do a chest x-ray, which will show increased radiolucency with absence of bronchovascular markings, like we saw from the previous picture. You can see in this picture. And there will be extent of the mediastinal shift. There will be pleural fluid sometimes. In this CT scan picture as well, you can see the abnormal collection of air in the chest cavity, which is compressing the lungs, then affecting the opposite side of the lungs as well. Coming to the treatment, It is a medical emergency. Tension pneumothorax is a important medical emergency that we have to read. And the first notion was that a large bore needle is to be inserted into the pleural space in the second intercostal space in the mid-clavicular line. But there has been some updates in the recent ATLS, which I'll be covering shortly. And the needle should be left in place until a thoracostomy tube can be inserted. This has been taken from the NHS website, the drain incision, the recent updates, and there is another update in the recent ATLS about the triangle of safety. So what exactly happens is that in case of tension pneumothorax, previously in emergency condition we used to do the needle thoracotomy in the second intercostal space in the mid clavicular line, but nowadays we are doing that in triangle of safety, and it is present on the lateral aspect of the chest wall. Previously the boundaries were mentioned that anterior border of the latissimus dorsi, lateral border of the pectoralis major, and a line superior to the horizontal level of the nipple. But this has been updated now, and the posterior boundary is now taken as the mid axillary line. So in this picture you can see there is the needle thoracotomy done in the second intercostal space. You can see in the picture on the right side that is mentioned B, the needle has been given on the upper part of the lower vertebra. Why? Because all the important neurovascular structures are present below the ribs. That's why anytime you are putting either a needle or a chest drain, you should be putting it just above the rib below. Now coming to the intercostal tube drainage, we make a small incision on like 1 to 2 centimeter incision on the above of the lower rib. Then we have to use a forceps to extend the hole. Then we'll be using our fingers. Then we'll be putting our chest drain. Then we'll be fixing it with some cover with gauze. This has been the recent triangle of safety. You can see the posterior boundary. It is now taken as the mid axillary line. Now you can see the rib below, that is the fifth rib, and we have to make the incision just above the fifth rib. Whenever we will use the intercostal tube drainage, we have to use the underwater seal. It can be used in many ways, like 1 bottle system, 2 bottle or 3 bottle system, as you can see from the picture itself. Now observation and nursing care is of utmost importance. So we have to check for the movement of the column in the underwater seal. We have to take note of the drain. We have to see how much collection is there, and we have to see for the lung re-expansion, any obstruction of the chest tube, or any blood or any clot. We have to be making sure about all these things in the ward itself. So this covers all the basic things about the tension pneumothorax. If you have any doubt, you can mention in the comment section, and if you need any video in particular, you can also mention that in the comment section. Thank you so much. Meet you soon with my new video.